Good morning, everybody. How are you?
Good, how are you?
Good. Glad you're here this morning. We'll do an exam three review. Okay.
Okay.
Um, Sarah, would you mind turning your camera on, please?
Sure.
Great. Yeah, there you are. So, how are you guys preparing for the exam? What are you doing?
I go through the PowerPoint. Yeah. Usually when I study, I review the material first and then I'll go to the review, like I'll go to yours and also I always only catch yours and Kershaw's.
Okay.
Then I compare what you both say and I take that into account.
Mhm.
And then I study the exam information, and I
Mhm.
also use my content from the notes for the week and the readings.
Good.
I
Good.
usually have all three together to compare, and then I do like how you say, I look at the questions and see if there's a possibility that it could be multiple answers. So like I number them, like this could be an answer, this could be an answer. I'll highlight it and study like that too.
Okay. Great.
So it's been helping me. I've been passing both exams doing it that way.
Good. Good.
I got a B on the first one and an A on the second one. I
Good
was
for you, Samaya. That's awesome.
happy.
What is everybody else doing to prepare for the exam?
So I don't have a hard time preparing for exam. It's just like the wording that I don't understand the questions. That's why I
Okay.
get the wrong answers mostly. I
Okay.
know the answers, I don't understand the questions.
Okay. So, what I'm finding when I'm doing my reviews, and Mehal, is that how do you pronounce your name?
It's Mehul.
Mehul. Okay. So one of the a few things I'm noticing when I'm doing exam reviews, especially for exam two, is that a lot of students are missing information in the question, a key word or a key term. Okay. So, what kinds of words are we looking for in a question that might direct you to the answer? So, I'm thinking priority. Think priority questions. What kind of words might you look at? Maybe first,
Yeah, first priority.
what is the best answer? What is the initial response of the nurse? What is the greatest? What is the least? Okay, you've got to be able to pull those words out of the questions. And so, my suggestion is always to read the question. And then, do you know, one of the students told me about this a while back, and it may have been one of you, I don't know, that there is a eyeball to the right of every question, right? And that you can highlight, right? So if you're going through a question, maybe you highlight a specific word. If it says, this is the one, there's two kinds of questions people are getting wrong. We're going through the first one. So this is picking out a select word or a select phrase, such as what of all the answers below, what is the best answer? Of all the answers below, what should be the first intervention? Okay, does that make sense? Okay, so one of the students said she goes through and highlights any keywords that come up right off the bat on the first question on the first time she reads the question. Okay, which I thought was pretty helpful because then when you go back and read it a second time, okay, then she takes the highlighter and puts a line through the answers that you know are not correct. Does that make sense? And so usually you can, you know, I'll do more test taking tutorials next week during my HESI review, but usually you can eliminate an answer, if not two, right? And if you cross those off right off out of the gate, and maybe highlight anything in the question that is important to answering the question, then that may give you a better chance at the correct answer, right? Mehal, does that help?
Yeah, I never tried that, but yeah, I will try that.
Yeah, try that. And the other thing is, when you read the question, try and come up with the answer in your own brain first before even looking at the answers, right? Or at least say, yeah, I know what this question's about. The answer should say something like whatever. And then go look at the answers and see if you have a match for that. Does that make sense? I mean, these are just helpful strategies I always provide to students, and I always learn when I do reviews. The other kind of question that's being missed frequently are the negatively asked questions. Okay, so what would be an example of a negatively asked question? You have to determine whether the question is positive or negative. Okay, so give me an example of a negatively worded question.
So like for the last exam, we had a question like what nurse should respond, like what she should not respond based on which sentence.
Exactly. That's a perfect example. So these are examples. So you're doing teaching with a family of that there's smoking in the house. What does the client state that you know requires more education? Right? So you're asking, what is she saying that's wrong that requires more education? Make sense? The nurse, this was, I think, a question on the RN exam. The nurse is working with a new nurse, and the new nurse is talking about discharge instructions. What might she say to the patient that you know requires more education? So what she's saying something incorrect. Does that make sense? This is important to understand because there's a lot of students missing these kinds of questions. Okay. So negatively worded questions, you have to be able to pull that out of the question. You know, if it says something like not appropriate, right? What's not appropriate? What's inappropriate? What's what somebody shouldn't say?
And the needs further teaching too.
What?
The needs further teaching questions.
Uh-huh.
Aren't they negative?
Well, it depends how you ask the question. Like, give me an example, Sade. What are you talking? Give me an example.
Like if they say, like you said for the smoking, you'll say that the patient needs further teaching if they say they quit smoking, but I think the question was like they smoke e-cigarettes or something like that.
Exactly. Yep. So what did the client say? After reviewing teaching with a client, what did they say that you then know they still need more teaching? Oh, I still smoke, but I don't really smoke anymore, but I smoke e-cigarettes or something. That would be incorrect that the client stated, and it would be the right answer if it's asking what did they state that needs more education. I'm trying to not make this complicated, but you have to be able to separate out if it's being asked I have to come up with a better word than negative. If it's being asked, well, it's positive and negative.
Like, I don't know if you can see that question or not, but like last exam we had question about the gay, if the parents find out their son is gay, so
Yep.
what nurse should not say about based on what? So it took me like 5 minutes to understand the question, forget about the answer.
Mm-hmm. So that was there was a couple of questions like that. So here was one. The client is working with the client is working with an LGBT family. What questions should the nurse ask that doesn't assume heterosexuality? Okay. So the answers people were picking were, do you have a wife and kids? Well, that's wrong because you're assuming heterosexuality. Or another one was, do you have a girlfriend or something? Well, that's wrong because you're assuming heterosexuality. Where the right answers were, do you have a partner?
Okay, so what was the question's meaning then?
So what it meant was assuming heterosexuality. So when you're working with that family, how do you ask open-ended questions that don't assume you're working with an LGBTQ family, right? So you want to be open-minded, non-judgmental, all of that. So what kinds of questions would you ask that family that doesn't assume they are heterosexual? But you have to know what the word heterosexual means.
Did you say I'm sorry, did you say the correct answer was, do you have a partner?
Right. So the question was, what can you ask them that doesn't assume heterosexuality? Well, if you ask them, do you have a wife and kids? Then you're assuming they're heterosexual. Right? But if you ask them, do you have a partner? That leaves them the opportunity to answer whether they're heterosexual or not. Does that make sense, Mihal?
Yeah, so we're trying to know their perspective.
Correct, without making assumptions. So if you were to ask them, do you have a wife and kids? You're making the assumption they're heterosexual. Where the question asked, what should we ask that doesn't assume that? So how about, do you have a partner?
And another problem is like the type of question we get in the community exam, like we never even saw them in the whole year for any class.
Good. I'm glad you brought that up. Okay. Remember, and I explained this at least to my group. Remember, why is this? Who do I have? I have Kiana. I thought I had somebody else in here. Kiana, do you remember me telling you at the beginning of the term, why is this class placed at the end of your program?
Yes, because it's like a tie-in of every other class up to this point.
Correct. Mehal, did you hear that? So community is placed at the end of your curriculum because you're expected to bring all the tools and information and knowledge from your other classes into community. Because essentially, in the community, we're providing med-surg, we're providing peds, we're providing maternal, we're providing geriatrics. Okay, so you are correct. I may not have gone over 100% of the information that's in your exams, but you have to bring that information forward. Like for exam 3, it's a lot of it's med-surg focused, right? And we'll go through that when we go through this. Well, let me pull this up. We pull the study guide out.
I mean, it's not about the material, actually. It's about the questions, the word about it.
Okay, I only heard...
I think I know the material.
I only heard a little bit of what you said.
Questions, wording that never like talked in a class.
Like, okay, so give me an example.
Like the question, like we asked about the LGBT question.
Okay. So you're saying that the questions are worded differently than your other exams?
Yeah, we never had a chance to read the questions like that. Like if we practice a question like that, then yeah, I would be like comfortable answering them.
Do you mean about asking the negative way?
Right. That was just
Okay.
an example. Yeah.
Okay. Okay. So yes, the community exams do ask negative questions. So you have to be able to understand whether it's asked positively or negatively.
Yeah, he's right. Because sometimes I have to read it.
You mute, Samaya, you're muted.
Sorry, no, I said he's right because sometimes I have to read the question a few times before I understand what it's asking. So what I would do is I would like sometimes like my last teacher and my last time for maternity, she taught us how to break down questions. So she would say, for instance, if you know it's like if it's a like I'll reply, for instance, what makes the most sense? So read the question with the answer with it, and that can help you too as well. Like if you know what the basis of the question, like say you know what homosexuality is, you know, okay, I know it's this. What like with the question about the different tests they can get. Can they get a test for AIDS? Yeah, that's true. Do they get a test for H? Like, you know, keep going down the list. Do they get a test for hepatitis A? No. Like she taught us how to break down the questions like that as far as with the select all apply, like read the answers and see if you can mark it off as like a true or false. So that's how I do like my negative questions too. Like I'll read it like 2 or 3 times and I'm like, okay, this is a select all apply. And I'll go through like what makes the most sense and what do I know about this particular like topic that I know that I can eliminate. So that's how I go into every question, even if it's multiple choice. Like if it's not a select all apply, I do the same exact thing. And that's what I was taught last term because we had teachers at Cincinnati campus that showed us, you know, how to break down questions. And even the online teachers, I would go to other teachers' classes, like how I'm going to yours, and I would get different information than I'm getting from my original teacher. And that's how I learned too, just going to other teachers' reviews and asking those questions in class.
Well, I mean, you should be able to pull, and that's what I mean by pulling out key words and key phrases. Like if a question said, what is not appropriate? That's a key phrase, right? What requires more education? That's a key phrase. So you have to be able to you have to be able to slow down and read these questions a few times. Okay. Samaya, I have also heard about that strategy from Select All That Apply, going through the answers and saying, is this true? Is this false? So that you can eliminate answers. I have heard that as well. Does anybody have any other, I just want to cover the study guide for a little bit here. Does anybody have any other test taking strategies that they use that are helpful, that the group might be able to benefit from? Let's look at the study guide. Oops. Can you guys see me?
Yes.
Share. There you are. Can you see me? All right. Okay, there we go. Okay. Okay, am I back? I keep getting these flashes that my internet is unstable. I have no idea why. All right, let's try this again. It's only happening when I'm sharing my screen. Oh, by the way, everybody put their name and professor in the chat so we can send the attendance around. All right, let's try this again. Share my screen. Is that better? Can you see that?
Yep.
Can you hear me?
Yes.
Okay, so this covers week 7, 8, 9. I put in what just copied and pasted from the modules, what the readings are in case you have to refer back to this. Remember, like week 8, look at week 8. It's med surg. What is going on here? Sorry. Week 8 is med surge. Okay, so you were introduced to these med surge topics in med surge. So now we're bringing them forward to the community. The whole purpose of this class is taking all the information you've learned from other classes, and we're bringing it into caring for clients in the community. That is what community nursing is. I mean, there's a lot of education, I get it, but if you're caring for patients in the community, you may be doing med surg nursing. Okay, you may be taking care with clients with cirrhosis that have been discharged from the hospital. You may be taking care of clients with all of these other conditions that have been discharged from the hospital and now are going to be cared for in their home. Okay. And again, week 9, a lot of your reading comes from your med surg book, chapter 45. Now, remember, when you're reviewing, what I would do is start with a study guide. Okay, because we'll be doing week 9 content today in class. So you're going to hear some week 9 content in this study guide. But remember, or in the study session, remember when you go back and review, like for med surg, it's giving you specific pages to review. All right, so don't go back in and read the whole chapter or read the section before or the section after. It's giving you very specific pages for you to study. So the study guide was put together as a combination from your readings, from the notes that we give you, from lecture. So if you've missed any lectures, go back and review the lecture, or if you've missed certain parts of the lecture, go back and review those parts. All right, but please stick to the readings. Please stick to the pages that we outline for you. There's a reason why cirrhosis, we only want you to read page 726 and 7 to 730. You don't need to read the rest of that chapter. Okay, so I would start with the study guide and I would highlight what you're comfortable with. Okay, what you're comfortable with, and what you need to go back and review. So, for example, let me just review something here real quick. So there's your readings. It's the same kind of test, multiple choice, math, select all that apply. Remember to select all that apply. Sometimes one answer might be okay. Sometimes all answers are okay. And with select all that apply, if you only have 4 selections, don't just assume there's only one correct answer. All right, select all that apply can have 4 or 5 or 6 answers. All right, so if they all look good, select all of them. But a couple of students said, oh, there were only 4 answers, so I thought only one was correct. I don't know why you would think only one was correct. It could be 2, 3, or 4. Right? So don't be afraid to select all that apply or select one. Okay, the other thing with select all that apply is the other thing to remember when you get to a question that's not a select all that apply, if all the answers look like they could be correct, go back and read the question because it probably says, what is the most? What is the most important? What is the greatest? What is the initial? Which will direct you to the most appropriate answer. Does that make sense? So that's a red flag if you get to a question and it's not a select all that apply and all the answers look good. You missed something in the question. Like maybe what's the first intervention you do? Okay. So I've gone through and highlighted in yellow the specific topics. So for example, if you go to study STDs, okay, and I've given you the chapter where it is. If you don't understand these 5 bullets for HIV and you want more information, go back and read that section. In the book, go back and review the part of your notes that we covered STDs. Okay. The study guide, remember, is a summary. Okay, so if you feel like when you're reading through HIV, chlamydia, syphilis, and herpes, if you feel like you have a good understanding of each of these, which you should also bring forward your knowledge from your previous classes, because I know STDs have been introduced to you all, right? I'm thinking in your med surg class, correct?
Yeah.
So based on that knowledge that you bring forward and based on the summary we give you in the study guide, if you feel like you have an adequate grasp of STDs, then leave it alone. You're okay with what's on the study guide. But if you feel like you need to, I'm not quite sure, I need to go back and read about syphilis, I don't have a great understanding of it, go back to the reading. Okay? But don't overdo it. A lot of students overstudy. Okay? The study guide is a good representation of what's going to be on the exam. Remember, we've put together the study guide based on all the resources you guys have. Readings, lecture, and notes. Okay? So if you have a good understanding of the concepts in the study guide, and I don't mean memorization, I mean being able to apply these concepts into the community setting, you'll do fine on the exam. Okay, so there's 5 STDs that you need to be familiar with: the HIV, the chlamydia, the syphilis, herpes, and HPV. Okay, and then the next section is infection prevention and control. I've given you the chapter where it is, chapter 17 in fundamentals and certain pages. Okay, so don't go back and read the whole chapter 17. Okay, there's 9 pages in chapter 17 that covers what we want you to know with regards to infection prevention and control. Okay, we want you to know about hepatitis. And if you go back and look at your notes, like especially up here with the STDs, your notes have much more detailed information about each of those. I have pulled out of the notes some more specific information. Okay, so start with your study guide. This is what I want you to know about each of the STDs. I gave it to you in bullets. If you go back and read your notes about each of these, you're going to find your notes are much more detailed. Go to the study guide. This is what I pulled out, what you need to know. Does that make sense? Okay, so infection prevention and control. We need to know about hepatitis. And we also definitely need to know about TB. And this is what we need to know about TB right here in your study guide. A lot more information in your notes, and that's good for knowledge and understanding. But as far as application of taking care of TB clients, here's what you need to know. Your 6 bullets here. What's the difference between smallpox and chickenpox? Can somebody please tell me where you're going to see lesions? The difference.
On the bottom of the feet.
Which one on the bottom of the feet?
Chicken pox.
You say what's the difference between chicken pox and smallpox?
As far as where you're going to see lesions, what are the key areas that are going to distinguish whether it's smallpox or chicken pox?
Smallpox, do it be like on your chest area, and chicken pox are all over?
Okay.
I think the smallpox you can see in the mouth.
Okay. Which of the smallpox or chickenpox you end up with lesions on your sole of your feet?
That's smallpox.
Smallpox.
What is it?
Okay. So remember that difference. If you're asked about smallpox, remember that difference.
The ones that have been running us out here, that's what I'm talking
Okay.
about. There's nothing wrong with it. Okay, then you
Right
could
here.
see, you could
I don't
see
know. Somebody needs to mute.
Constance Daniels.
Hang on. Who do we need to mute here? Okay. It's right here. Were you with your smallpox right here? Whoops. Can you guys see me and hear me?
Yes.
Right here. That's what I want you to, if you get a question about the difference, right? This is about smallpox. Okay. Rash appears on the skin, starting in the face, spreading to arms and legs. That's chickenpox too, right? Then to the hands and the feet, to the soles of the feet. Chickenpox doesn't appear on the soles of the feet. Okay. The other thing is foodborne illness and food safety, because we're talking about infectious disease control prevention. So here's some examples of when you're teaching about foodborne illness and protection and prevention. Here's some food safety tips. Okay, and there will be a question about this. You know, you're given a scenario. What are you teaching the patient, the client? Okay. How long do you boil the water? Do you add bleach? Cook food thoroughly. Okay, so read through those. And then with waterborne illness, what do we want to know about that? How is it? How is it? How does it happen? What's the transmission? What are some common waterborne illnesses? Cholera and Giardia. Okay, remember as we hear about natural disasters that happen all over the world, what do we always hear is the biggest concern with regards to communicable disease?
Infection.
Yeah, cholera specifically for waterborne illnesses. There's a lot of information about disaster management in your notes, and you're asked to cover all of chapter 44 and med surge, but I've broken down for you what I think is important for you to understand the concept of what our role is in disaster management. Because as nurses, we always have a role in disaster management, whether it's preparedness, whether it's the response, whether it's aftercare. Nurses are kind of expected to function in all levels of disaster management. Okay, so what do we need to know? You need to know there's two kinds of disasters. Each time you read a bullet, think about the information that's being provided to you, and then come up with a question. Come up with some questions in your head. What might they ask about? So here's a good example. Disasters are labeled as natural or man-made. Okay, and then the rest of this goes on to give you examples of a natural and a man-made. So what question, if you were asked about this, what question might you get?
Like, what's the natural disaster example?
Yep. Or maybe you're given a scenario of an actual disaster and you're asked to, is it man-made or is it natural? Or maybe another question is, there's two kinds of disasters. What are they? Right? So let's read this one. Water can be considered safe for drinking, boiling after 3 to 5 minutes, treated with household bleach, and removing hot water from hot water heaters or commode tanks. Okay, so what questions might you get about that?
Say bleach is safe.
Yep. If you add bleach, how much bleach do you add? 1 ml of bleach to a gallon of water. Let it stand for 30 minutes. What about a boiling water question? What if it says water can be considered safe for drinking if it's boiled for 30 minutes? That's incorrect. It's 3 to 5 minutes. Right? Maybe what are some safety tips when teaching a family who's been through a disaster? What are some safety tips you can help them with? Maybe select all that apply. Well, you can boil your water, you can add bleach, and you need to remove your water from hot water heaters or commodes. Okay? Here's another. If a chemical spill occurs, use tongs to remove all clothing. Here's a couple of chemical. We have vesicant agents, respiratory complications, nerve agents, an example, respiratory complications, blood agents, dermal and respiratory complications. Okay, so what kinds of questions might you get from that little bullet? Maybe, what do you use to remove clothing? Maybe, let's see, nerve agents. So sarin, you've had a chemical exposure to sarin. What's going to be the most important complication? What's the answer?
Your nerves complication.
Respiratory.
Okay, you have a cyanide chemical. Somebody with a cyanide exposure shows up to your ER. What are the two most common complications? Or what's the most common complications? Well,
Skin
and respiratory. Maybe what are the most common agents in chemical spills? Vesicant, nerve, blood.
I'm sorry. Can you repeat that? You say what agent for skin?
It's right here. Blood.
Oh, okay. Blood agent. Okay.
Yeah, right here. So I just listed 5 questions that could be asked about that. About this little bullet. How do you remove clothing? What are the 3 kinds of agents that are most common for a chemical spill? You're treating patients who may have been exposed to mustard. What kinds of complications might you see? Ocular, dermal, and respiratory. You're seeing a patient that was had cyanide exposure. What kind of complications? Does that make sense? So read the information I'm giving you and then come up with questions we might ask. Post-op care. I don't know. Post-op care. Well, we know that the ABCs are critical, right? Post-op care. Airway, breathing, circulation. That's most important. What are some potential complications?
lungs.
Okay. The lungs, airway, breathing. Think of your ABCs. So when you think of atelectasis, it sounds bad, but mild atelectasis is expected, right? That's expected. You should have learned this in med surg. It's expected after anesthesia for the first 48 hours. Okay? This is considered normal in the first 48 hours. Okay? When you're doing assessments, well, okay, so go back there. So you may get a question about what is atelectasis? Is severe atelectasis normal in the first 48 hours, or is mild normal? Okay. Assessment. What are you doing for assessment for a post-op patient? Well, here's all what you're doing. Okay. Respiratory rate, SATs, lung sounds, mental status, pain, bowel sounds, bowel movements, temperature, urine output. So, I don't know. What kinds of tasks are you going to be performing for a post-op patient? in the assessment phase. Well, there's a list of about 8 of them. And then what if you get asked about how do we discharge a patient from the post-op to the floor? You guys have all heard about the Aldrich score, right? Yes? No? Okay. Well, if you haven't, what it is, it's a chart, or it's a system in which we score to see if a patient's ready to go leave the PACU. Okay, so if they get a score of 8 to 10, they can be discharged. Okay, if it's below 10, they need to stay in the PACU until an 8 is reached. So it's kind of like an APGAR score for babies. Okay. What do we know? Also, another complication of post-op is what? Thrombophlebitis. What's thrombophlebitis?
Clots.
Mm-hmm. Right? And I mean, most people that have limited mobility after surgery, people that have limited mobility after surgery are at risk for thrombophlebitis, right? Then cirrhosis. You're going to get asked a question about each of these. Okay, you're going to get asked a question about cirrhosis. Okay, about peripheral artery disease, chronic venous insufficiency, hypertension. So go back and review what I have on the study guide. Okay, there's a lot more information in your notes, but I have summarized the most important points for you to understand what the condition is and what the interventions are in taking care of clients with these conditions or diseases. All right. Okay, so go back and review those sections on those conditions. Hospital-associated or acquired infections. Okay, so there's a small section here on how do we prevent hospital-associated or hospital-acquired infections. Okay, proper hand hygiene is the single most important aspect of medical asepsis. We know we want to be teaching that we have to wear N95s for airborne diseases, such as what?
COVID.
TB.
Tuberculosis.
Yep. Suggested for a private room or negative pressure room if it's an airborne, talking about TB. And then what do you do in the home? You know, how do you take those precautions and teach clients in the home? Well, here's a couple of suggestions. Gloves. Okay, what you do is soil dressing. Because you know what? People with, let's say, wound care, they're not going to stay in the hospital till their wound heals. They're going to be coming home and you're going to be taking care of them in their home. So you still have to maintain, right, the proper hygiene and the proper disposal of soiled clothes, soiled dressing, linen, whatever. Okay? And HIPAA. HIPAA is always important to talk about. What is HIPAA? It's the Health Insurance Portability and Accountability Act. Okay, so it's essentially protecting sensitive information, health information from being disclosed without the patient's knowledge. I mean, everywhere you go, you have to sign a HIPAA release. Everybody, you guys know what HIPAA is, right? As nurses, you should know what HIPAA is. Okay, so here's some information about HIPAA. Discuss patient only with staff involved. Know how a patient's information is stored. turning off computers when you're at the nurse's station and you're done, not leaving stuff on the printer, right? So that's a summary of what you need to know about HIPAA. And then with regards to malpractice, what is malpractice? Malpractice is essentially negligence by a professional person. Okay, what you need to understand is four elements. There are four elements of malpractice that have to be met before you have a case for malpractice. I'm sorry, three of them. That's wrong. I didn't change. Okay, three elements. There was a breach of duty. So you did something outside your scope of care, or you did something that the average nurse would not do. So it was a breach of your duty. And causation, okay? There has to be proven that there was a cause that created that breach. And then that there has to be proof there was injury or damage. So here's a couple of examples. Falsifying documents on charting, causing direct injury to patients that otherwise wouldn't have had the injury because of your breach, or death caused by problems created by nursing. So what questions might be asked about malpractice? What are the three elements, or what are the three factors that need to be met? What is breach of duty? What is causation?
Or you might get a scenario saying you did this action, so what's it gonna be?
What exactly? What are some examples? Select the examples of negligence: falsifying records, causing direct injury to patients. Okay, cultural considerations of religious influences on patient care. Here's a list of things that we need to take into account when caring for patients that are from different cultures. Okay, we know that certain religions only eat certain butchered meats. For example, Jewish like kosher meat. Muslims don't eat pork. There's two examples for you. Okay, we need to be aware of what their values and beliefs or cultural practices are with regard to smoking, drug use, herbal medicine, nutrition. These are all part of our assessment of when we're planning care for patients from different cultures. So these what needs to be taken into consideration. And then we need to understand about your scope of practice as an LPN, LVN. Okay, what's important to know about your scope of practice and what you can delegate. Okay, so you need to understand what kinds of patients can you not delegate a nurse assistant to?
Unstable patient.
Don't need assessments.
Yep, I heard unstable patient. That's a good answer. People that need assessments, that's a good answer. So let's read these 4 bullets. All right, you need to understand what you can and cannot delegate, and what types of clients you can't assign to nursing assistants. Right, you have to make sure that they're willing to take the responsibility for the care they're assigned. Right, they're not assigned patients who are unstable. It doesn't fall into their scope of practice of an unlicensed person. Right, and there's several things that need to be done when delegating. This is an important bullet right here. Okay, when delegating, you need to give specific instructions as to what, number 1, Specific instructions as to what needs to be done. Number 2, you have to instruct on how that task is to be done. Number 3, you need to give them the information that needs to be reported back. And number 4, know that you're responsible for the outcome of delegated care. Okay? So you need to have an understanding of the scope of practice and delegation. And then the last part is prevention of accidents.
For sure. And that's why I was getting upset because
Okay, hang on a second. I don't know who keeps coming off mute, but it's kind of distracting and noisy. Last part is I want you to go back into chapter 45. There is a section that lasts about 2 pages, and it gives you home safety tips, highway safety tips, and water safety tips. Okay? I just honestly didn't have time to go back in and copy and paste it. So I want you to do that. It might even be a page, but there's a very short section on, go to the section that's prevention of accidents in chapter 45. Just review I think they give a few examples of prevention for each, for home, highway, and water. So please go back and review those. Okay? Does this help? Anybody?
Yes.
Has this been helpful?
Mm-hmm.
Okay. I recorded this, so I'll be sending it to your instructors and they can post it. So if you want to review it again, it'll be posted in all the sections. Okay. And remember, after doing your own due diligence and studying and preparing and attending reviews or watching recordings, going through the study guide, if you're still having issues with certain topics or concepts, set up an appointment with your professor. Okay. Before the exam and have her review those with you. All righty? Any questions? Thank you guys for coming. I appreciate you prioritizing.
Thank you.
All right. Good luck on your exam.
Thank you.
Thank you.
All right.